Thank you, Tina. All right, so we're going to be splitting up the awards today into two different sections. We've got 8 to give away in total, so we're going to do 4 now and then 4 after lunch. And I'm really excited about these. This was the biggest submission year we've had. We had a lot of people send in very compelling things. It was very difficult to pick specifically which ones. We're going to try and pause after each one to let the person who receives the award give a couple of words, and then I'll transition straight to the next one after that so we can keep things moving. So for our first award today, we're going to be giving out the first of 2 community impact awards. The first winner came face-to-face with a decision as the COVID-19 pandemic began raging back in fall of 2020. They had to decide whether to lead their community into either the vaccination phase and help with the pandemic that way, or continue to focus on their current patient care and passively allow others to address the needs of vaccinated community. Deciding to assist in the vaccination plans, they set up a clinic and gave out their first vaccines on December 18th, 2020. During the time operating, the clinic administered over 29,000 vaccinations to people in a 4-county area, as well as some from outside of that area. For their dedication to helping end the pandemic by focusing on vaccinations to help stem the tide of the pandemic, we'd like to give this first award for community impact to Cameron Memorial Hospital.
And Angie, I think you'll be able to speak now.
Hello, everyone. Can everyone hear me okay?
Yes.
All right. Thank you so much. You know, I was thinking about this award today, and my name is Angie Logan. I'm the CEO of Cameron Memorial Community Hospital up here in the northeastern region of Indiana. I have my leadership team here with me who has played an essential part in our pandemic, part of the Incident Command Center along the way. And as I was thinking about this award today, it's very humbling and surreal to get an award for just doing what we do and taking care of our patients and carrying out our mission. So we're very humbled by that. I think similar to every hospital on this call, the pandemic has really just brought us all together and really taken us along a journey to get things done together. And so what's inspired me along the way with our team here at Cameron is really just our team's ability to always say yes. It's just a part of our vocabulary here. We were at a crossroad, as David mentioned, to continue to take care of our patients and focus on our core services, or actually in addition to take on a mass vaccination clinic. And our team unanimously said, yes, we absolutely want to do this. And so we continued along that journey. And it has been probably one of the most inspiring things that I have ever seen. The stats are staggering, 30,000 vaccinations in 115 days. But what I want to say is really, I just want to thank all of our employees, our dedicated volunteers, our community members, but I also want to thank our regional partners. Not only has this brought us together as a community, but it's really brought us together in neighboring counties across the state. The partnerships have just been phenomenal. And so that has definitely been a bright spot along the way as we've worked to get on the other side of this pandemic together. I just want to mention 2 people publicly. The list is endless of the people that have helped put this together, but I do want to say a big thank you to Jennifer Haggerty and Sarah Hagen, who both were the main leaders in carrying out the vaccination clinic to success. But again, the list is endless after that. So again, we're very appreciative, and on behalf of Cameron, very honored to receive this award. Thank you very much.
Thank you, Angie. For me getting all these different ones in, it was really impressive to see the amount of work that went towards vaccination, which was something that the state kind of struggled with in terms of vaccine hesitation. So it really stood out to me, just the volume and the amount of time that you guys put into that effort. So moving on, for the next award, we wanted to spotlight work that a hospital did with a specific community partner to better the health of their community. The hospital and that we're talking about today wanted to start a discussion about how to assist community members and their friends and families who are struggling with or otherwise having experiences related to suicide in the county. At that time, the county was identified as having one of the highest suicide rates in the state. The rural community, approximately 17,000 people, had experienced 13 suicide deaths in 2016 and 2017. This led to the creation of a group in 2018 that continues to grow as a visible and expanding member of the community today. The goal was to increase the number of suicidal ideation hospital visits and decrease the number of suicide deaths, hopefully indicating that more people were talking to hospital providers and others about their challenges before an attempt was taken. Thanks to a wide range of programming brought about by this community partner in direct work with the hospital, we're very excited today to award the Critical Access Hospital Community Partner Award to both Rush Memorial Hospital and Spark.
Well, thanks, David. Good morning, everyone. I'm Brad Smith, the CEO at Rush Memorial Hospital. Joining me is Deb Hummel. She's a VP of Quality and Infection Control. She's also the president and chairman of our Spark organization that we formed several years ago. But it's definitely an honor to receive such an award, to just recognize all the hard work that has gone into just all the efforts that have brought awareness to our community about suicide in our community. This all started with a young man coming to my office. He was just in high school. He was a suicide survivor, and he sat down in my chair in my office and he just told me his story. And I was just, it was all eye-opening to me. I didn't realize the things that were going on in our community kind of behind the scenes. What I realized very quickly is that this young kid explained to me that there was the kids in the school formed their own little network, their own little support group to help each other get through these hard and challenging times. And I was just taken aback that, you know, my first question was, where's all the adults? Where's all the organizations? Where's all the services? Why do these kids have to form their own network to you know, support one another, to get them through very challenging times in their lives? So I made a commitment that day to this gentleman, and I said, the hospital will help. We will make sure that we do everything we can to create awareness, that we provide as many services as we can in our community to help not only with kids, but adults as well. And we will bring suicide, you know, bring it to light to our community and make people aware. And that's where you have to start first. And so we formed an organization called Spark. And Spark stands for Suicide Prevention Across Rush County. And it was just a number of volunteers coming together, hospital volunteers, volunteers from the school, volunteers from the community, volunteers from the churches, you know, police, fire, anybody that volunteered. It was a great group of people. And we just had an open discussion one evening and everybody jumped on board. And Deb Hummel, which is joining me today, really took the lead with this organization and led it where it's at today. I mean, she's worked very hard with the rest of the volunteers to make sure that we bring awareness. And we actually provide services to our community that was long overdue, very long overdue. And I'm proud to say that we are making an impact in our community. We have a lot of work to do still. It's never done. Suicide prevention is never done. It's something that you always have to keep your thumb on and always be available any time of the day, any day of the week, 24/7. And I think we're working towards that. So Deb, did you want to say anything? I know, again, Deb has played an integral part in our Spark organization, and the hospital is a huge supporter of that organization. So Deb, you want to say anything while you're on here?
Yes, just very quickly, I'd like to say thank you to the hospital for supporting Spark and allowing us to utilize the resources of the hospital to make a difference and an impact in the community, as well as everybody else who has worked with us. Lori Gert is on this call today as well, and she has been instrumental in working with us at our mental health work as well with regards to the SHIP program. But as Brad said, the work is never done, but we appreciate the recognition as we continue through this journey. So thank you.
Thank you, David.
Thank you, guys. All right, continuing right along. The next award that we're going to be giving out today was, so kind of when we started like looking at this next award, we wanted to find a hospital that had improved critical access hospital patient and family experiences in ways that like were unique and directly aided their patients in some special way. So the winner of this award implemented a Da Vinci robot program for their OBGYN and general procedures. Implementation of these robot surgeries helped to provide innovative healthcare locally so that members of their community did not have to drive long distances to receive high levels of care, which directly addresses one of the biggest ongoing issues we have in rural, which is that of transportation. The program has proven itself to be so successful that they've also expanded their robotics program to now include a ROSA machine for their orthopedic surgeries. For identifying a unique way to aid their patients during this difficult time, we'd like to present the Critical Access Hospital Patient and Family Experience Award to Woodlawn Hospital.
And Paula McKinney, if you are signed in underneath a phone number, please chat that in so we can unmute your line. I'm not seeing Paula McKinney was going to accept the award today, and I'm not seeing it under her name. So we'll give her just a minute to chat in her phone number. And David, while she's doing that, maybe we can announce the next award and then come back to Paula.
Sure. So for the last award we're going to be giving out this morning, we've got more coming this afternoon. We've got another 4 activists. We're going to be looking at one of the biggest heroes of this past year. So our winner is the only quality nurse at their hospital and spends a great deal of their time performing lengthy manual audits and concurrent chart reviews. So on top of this work, they also volunteered a lot of their time, sometimes greater than 6 hours a day, to their local vaccination clinic in the county. So according to the submission that got sent in to me this year, they felt that the selflessness and commitment to improving the health of their community went largely unrecognized, even though it personally inspired those that they worked with. So we wanted to take the time today to award this year's Critical Access Hospital Hero Award to Annette Murray of IU Health Tipton for their stellar work during this incredibly trying time.
Go ahead, IU Tipton.
Hi, Becky. This is Annie. Can you hear me okay?
Yes.
I can't quite get my video to share. I love those electronic gremlins. But I want to recognize one of our nurses who is our senior project manager for our nursing administration, Teresa Burns. Also, along with this, she was very instrumental in spearheading our Tipton vaccination clinic and overseeing the operations to allow a smooth service to the public. She did all the behind the scenes work and stuff, always chasing an arm to find so that no one dose would go unrealized. So this was a huge team effort, working our hospital. A few of our nurses, we even pulled nurses out of retirement. And then Teresa also volunteering her time along with me and others to serve and help with our local Tipton County Health Department to serve our public. And I want to thank Luke, one of my peers at the hospital, for nominating me, and I really appreciate that.
Hi, this is Luke, the infection preventionist for Tipton Hospital. I'm not going to let Annette defer praise here. So for the first half of 2021, we opened a vaccine clinic with the Department of Health. And along with Teresa, Annie was one of the only people who was a staple of that vaccine clinic hours and hours a day. She would bring a yogurt and a granola bar, and she would eat while she was observing patients. And then as soon as that ended, there was a call to provide these vaccines for these migrants because we are a pretty rural community. And she was the first to put her hand up for that as well. And she's done that, I think, twice. And so just seeing her, make every effort that she can to get these vaccines out and to help our community is really, really inspiring.
Thank you very much, Luke, for those kind words. You're right. You said it better. But no, thank you very much to everybody that works in rural health and critical access hospitals and rallies together to help support other partners and their health departments in supporting a huge need like it has been this past year. So thank you very much. It's been an honor to receive this.
All right. And that's the awards that we have to give out this morning. Have we heard if Woodlawn is able to step in and receive their award, Becky?
I don't see them as a panelist, but we'll check with Paula and we'll have her speak this afternoon during the individual session. But great group of award winners and very proud of everyone. So at this time, we're going to be preparing for a break. The team